Well, I get asked the question, why would providers want to come to Alaska and work in our clinic? And the answer to that is, first of all, Alaska is just a great place to live.
There's some wonderful states down in the lower 48, but none of them compare.
When I got to the peninsula with my small children and my husband, something hit me. This is my town.
I think Alaska, just in general, came up here just kind of for fun, just to do something different.
It's a place where the environment is conducive to those folks that like to do things outdoors.
It's for people who like the West, like mountains, like the ocean, like outdoor sports. There's really nothing like it.
I mean, growing up here, I have lots of good memories going fishing on the boats and playing sports and traveling all over, and it's a great place to grow up.
I came here because I loved the possibilities in Alaska. I loved the eclectic population. I loved the opportunities of playing after work.
It's a great place to raise kids. I actually moved away for a couple years and I came back to raise my children here.
Because our community is a community of people helping other people.
It's a place where we have small communities with a strong community feeling.
You get to know everyone and you get to follow them.
It's nice to be in the community and actually see how that affects not only them there in the exam room when you're looking at them, but how they're functioning better in their home life and in the community.
In a big city, you see people once, you may never see them again. It allows you to practice differently knowing that you're going to see them again. You can be a little more cautious, do things more slowly, watch and wait.
Working at a community health center for me is nice because we can do about everything medically there is in a family practice. We have a full range of practice, which is nice.
Doing all the emergency room work, doing the inpatient work, and seeing everyone in clinic.
I'm sure that me, as well as many other people, are just brought because we like to deliver care to people who are in need of care, and we certainly have a lot of that in our region.
I chose to work here because of the mission that we have for the patients. We see patients regardless of their ability to pay, and I think that is truly the reason why you are in the medical field, or should be in the medical field.
I am with pediatrics here in this clinic, and my biggest concern and my focus is reaching out to the kids and the education and the awareness, and so I get a lot of that through the community health center.
And it's not for everyone, for sure. And then some people, it wouldn't be their cup of tea to be kind of practicing alone, not having a surgeon standing behind you and an obstetrician behind the surgeon and all that stuff. So and that's just a personality thing. Some people are looking for this kind of thing, and other people are looking to work a 9-to-5 job and have a panel of specialists doing all the other stuff.
If you don't want just a 9-to-5 job and you want some satisfaction in knowing you really are helping people out, and I think that's what we do here, and that kind of the real reason most people, go to medical school.
So I'm looking for clinicians who are willing to share the responsibility and glory of primary care with a wider team. I'm looking for clinicians who understand that everybody who walks in the door is deserving of the highest quality services we can possibly provide, who aren't going to make any judgments or preconditions on anyone, but treats anyone equally and with the same amount of integrity that they would provide to their own parents. I really believe that many people in private practice wish that they could do the kind of practice that we do here at a community health center.
It would really be appealing to a lot of physicians if they just knew sort of that we're out here and that what we're doing.
We have built an environment of a strong support staff, a quality professional provider staff. We and other community health centers in the state have paid a lot of attention to providing the kind of benefits that make this a comfortable setting to work in.
This is a place where you can actually act on the motivations that led you to go to medical school. Here's a place where you can do the right thing, get paid for it, have your malpractice covered, have a reasonable schedule, work with exciting and excited colleagues, work with a supportive administration. What a deal.